and thank you for joining MVMA's first COVID-19 update session with Dr. Matthew Boyle, MVMA President. I'm Nicole Cass, CE Program Manager for the MVMA, and I'll be your moderator for this session. If you have any questions, please type them in the Q&A area. A quick introduction for those who are not familiar with WebEx, or it's been a while since you've used this platform. If you click on your screen along the bottom, you'll see a series of circles. Look for the black one with the dots. Click on it and you'll see Q&A. Click on the Q&A and a window will appear for you to begin typing a question or some type of response. We are going to hold all questions until the end, and I'm sure there'll be a lot of them. So with that, I'm going to go ahead and turn it over to Dr. Boyle.
Well, good afternoon, everyone. Can you hear me okay, Nicole?
Yes, sir.
Okay, great. Well, welcome, everyone. Thank you for investing an hour of your time with us today. I know it's been an incredibly, been a very busy, very stressful week for everybody. We're all operating in a time of great change, a lot of uncertainty, and a fair bit of ambiguity in a lot of areas. So hopefully we can provide a little calm and a little bit of clarity today on what we're doing here at the MVMA. But none of us are immune to it. Our kids are, of course, out of school, and so we're trying to learn how to administer that curriculum here, but I've sent them to the basement for their lunch break, and I've got our busy German wire-haired pointer outside, so hopefully we'll get through this without a whole lot of disruption here at my home. What I'd like to do today is kind of visit about what your MVMA is doing around COVID, also about what the AVMA is doing. We'll talk a little bit about what's happening legislatively. There was some new legislation passed yesterday and signed by the president either last night or this morning that we'll talk about. I also want to give an update about what's happening at our college with our veterinary students and address a few questions that have come in online prior to today, and we'll take any questions at the end. I'll do my best to answer the questions as best I can. Kind of the joke I've been telling people is that although I assumed the gavel from Dr. Sheftel at the convention a month ago, in that month's time I didn't acquire a whole lot of, I didn't become a COVID expert overnight, but I've done a fair bit of reading, and I'll answer the best I can and make sure that you have access to the resources that you need should I not be able to answer a question. So obviously this has been I've visited with several of you by phone and by email, and a lot of my colleagues here at Zoetis that are trying to answer questions for our veterinary colleagues around the country. But it's a time where we're really trying to balance a lot of responsibilities to our businesses, our employees, our clients, our families, and of course trying to be part of the greater public health. I know for a lot of people, you look at that picture there, we're trying to be that rock on the bottom of that pile, but probably a lot of times we feel like we're that one right in the middle where we're trying to hold a lot of things together, and like I said, operating in a lot of uncertainty and change. So acknowledge a lot of the challenges you guys are facing, trying to balance the needs of your patients, your employees, your clients, your families, your own health, keeping your business solvent, and then doing your part for public health. So fully acknowledge the challenge that all of our colleagues are facing right now. These are the sorts of questions that are being asked of you to each other, of you to us, to me, amongst my colleagues. You know, a lot of questions about business operations, a lot of questions about protection of employees, about operating the business in uncertain financial times. You know, specific questions about the epidemiology of the virus, what's happening legislatively, and the actions that we put in place at MVMA will hopefully get the resources out there that you guys need to answer some of these questions or help you think about how you might deal with some of these questions, you know, in your own lives. That question there, second to the bottom, are veterinary clinics essential businesses? And that's a big one that's being worked on both at the national level with AVMA and with us here at MVMA with our local government. And we'll talk about that later in the presentation. So let's start with what is the MVMA doing? So obviously this situation with coronavirus has been building over the last several weeks, but it seems like things really ramped up about last Thursday or Friday, and a lot of things really happened over the weekend. And so this Monday, this previous Monday on March 16th, we convened a conference call of the board of directors, and really kind of focus that conference call on these three questions is kind of how I positioned it to the group. So what are those things that we should do for our members? What are the things that we can do? What can we realistically do? And then to also be realistic about what of those things that are outside of our scope. You know, for example, making specific, you know, business recommendations might be outside of our scope. So this is kind of the framework for the call that we had on Monday. Outside of that meeting or following that meeting, we put in place a series of action steps, and I'll talk about what those are now and what we've been doing this last week, and then some things that have been happening prior to this week. So the actions that were started following our conference call this week is that is some of you that have been receiving this information. Our great staff at the office have been continuing to push information and resources out to everyone through social media, on our Facebook page. Things from like, institutions like MVMA, CDC, Minnesota Department of Health, et cetera, these sorts of organizations. So hopefully you are seeing those resources and having access to some good information. So Facebook feed, here's just an example of one of the things that was pushed out. Was a document from the MVMA, just some general information about coronavirus. But there's lots of different documents that are being pushed through social media. We will continue to do that. Just in the last 10 minutes prior to joining this call, I sent a couple of new documents down to the office that you should see posted pretty quickly. Regarding some new guidance documents from the Minnesota Department of Health and the Board of Animal Health, as well as an update from the MVMA on that legislation that was passed last night. So we will continue to do this, continue to push things that are current and relevant. Secondly, that we have created a section on the MVMA webpage for COVID-19 resource and resource links. If you go to the home page, there's a button that will take you to a second page, which is where those resource and resource links are located. Those will be updated as new things come available. Here's what that page looks like. And so there's lots of things here about different things. So there would be some business stuff here, some COVID, general information things, and then information coming from the MVMA. So there's lots of different things that you can find here. It will be updated. Importantly, I think this is one that people have been asking for a lot, looking for some practical advice about specific things, practical advice about handling animals, practical advice about interacting with clients and veterinary facility operations. These documents from the Minnesota Department of Health and Board of Animal Health have just been, like in the last half hour, finally approved for distribution. They are one-pager front and back, just very practical guidelines. These will actually be housed at the Board of Animal Health website, the thinking being that that's where most veterinarians will go to find them. But they will be linked from our resource page at the MVMA.org as well. So these are some very good practical documents that you'll find there that just in the last half an hour became available for public consumption. Number three, one of the things is a lot of these questions that were coming in, some that we can answer, some that we can't answer or probably is not within our scope to answer, but is really important for all of you to be able to network with each other about what you're doing with your practices. Perhaps both in terms of animal care, disease prevention, and just business operations. So we decided that it was important to build a forum for member sharing. And if you, when you get to the COVID resource page at MVMA.org, you will have the ability to join a Facebook group, as well as an email listserv around COVID-19. So if you're like me, I've been a social media holdout I don't have a Facebook page, so email listserv would have been good for me, although I broke down and I'm trying to get a Facebook page so I can participate in that group. But much to my chagrin, my first application to Facebook was denied, and they somehow thought that I wasn't the person that I was purporting to be. So I'm trying a second time to get a Facebook page so I can participate. This was just started yesterday, and I pulled this screenshot, and within 17 hours, we had 90 members. So I've not been able to see it yet, but hopefully you guys have been able to share good information and best practices with each other. I think that number this morning was close to 110. So we hope this forum will be a good place for you guys to talk about what you're doing, good practical suggestions and practical operations for veterinary businesses in this time. Number 4, as this webinar is number 1 of a series of webinars that we intend to have. This one today is really just an update about what we're doing and what's happening legislatively, both locally and nationally. But our intention is that these webinars will, as the situation evolves, will include other local veterinary experts and different entities that can answer specific questions. Next week, we will be having Malia Ireland from the Minnesota Department of Health. We will also probably try to engage people from the Board of Animal Health or the Board of Veterinary Medicine. You know, around you know, some of the state board statutes, there's been a lot of questions about how do we apply telehealth, how do we apply teletriage, questions around VCPR and continuing education. So I think there's a lot of questions that the Board of Veterinary Medicine could provide some more specific answers. So we will be having these webinars weekly, so watch for them, you know, of a different angle each time. We also will look at having an attorney come on one of these webinars to talk about some of the workplace and business issues that you guys are facing. In the meantime, and that's, I think, is a very good resource for several of us, Soberg and Tibelius have offered to provide brief complimentary consultations to our MVMA members about questions around practices and procedures pertaining to COVID in your hospitals. So this is a very, very good service they're offering, and I would please, if you do choose to take advantage of it, make sure and thank them. So in the meantime, you do have this at your disposal as well for specific questions around business and employee issues. Number 5, and this has been a real big one this week, or particularly Dan Chernahoy, your executive director, has been regularly communicating with and providing resources to local government stakeholders. And the reason this is really important is that if we see increased regulations or things pushed down to local businesses, we need to make sure that veterinarians are seen as essential businesses. So that we can continue to operate. And I think all of us understand why veterinarians are essential businesses to not just society in terms of public health, but client and public well-being, frontline for zoonotic disease detection, frontline for the production of safe food and the food supply. So we are continuing to work with and provide information to the Minnesota Ag Commissioner, as well as the Board of Animal Health, and our lobbyists are working too to make sure that the people that need to see the information and our talking points, we can drive this message home about veterinarians being seen as essential business. So this is something that's ongoing, reaching out to Dan has been trying to reach out to a number of legislators this morning as well, with some key documents that the AVMA has provided. What else have we been doing? Now, this has been going on for a couple of weeks prior to these new things, but we've been continuing to monitor our investments at MVMA. You may remember from convention, if you were there and you saw the annual annual report from MVMA, that we are in a really good spot financially. So we need to make sure that we are good stewards of our resources. So this group of people, Dr. Sproul, Dr. Windsor, Dan, myself, have been in communication with our financial advisor to make sure that we're doing the right things with our investments. To this point, we've not made any changes to what we're doing. Thankfully, we don't need our investments to operate at this time. And also, thankfully, we are past convention, which is one of our revenue streams for the year. Had we not been able to have our convention, that things might look a little bit different. But at this point, we've not made any changes to our investments. We are continually monitoring this to make sure we're good financial stewards of our resources. Just for your information, because of the way our money is invested, our investments only see about 60% of the market swings. So the market drops 10%, we drop about 6%. So we will continue to monitor these resources as well. We are also taking care of our staff. Of course, we want our staff to be healthy. We want their families to be healthy. We want them to feel safe at work. So one of the investments that we had made last year with our resources is that we made some upgrades at the office, and part of that included some new remote workstations, some new computers. So our staff is able to work more remotely when they need to, and they will be working more remotely. At this time, there will be somebody at the office, at least somebody there every day, for now anyways. And these changes really should not be disruptive to the services that we provide to you or the other people that need to communicate with us right now. And I want to send a thank you out to the entire staff at MVMA for their quick work and the urgency that they really have worked under this week. A lot of things have had to happen pretty fast, and they've been very responsive, and they're doing a tremendous job. So if you call into the office for anything, make sure you thank them for the work that they're doing. What is the MVMA doing? Of course, like a lot of associations, they of course have a resource page with a very robust set of current resources. That place is getting a lot of traffic and a lot of media representation, so that's very good. Probably the biggest thing that they're really working on right now is advocacy efforts in DC as this new legislation has been moving forward. Just to make sure that veterinarians and veterinary businesses are appropriately represented and taken care of as this legislation passes. We know that this situation is going to create some hardships for individuals, families, and small businesses. Now, if you think about what MVMA has been doing this week and what AVMA has been doing this week, and you sometimes wonder where your membership dollars are going, what's been going on this week is a very good example of money well spent, because there is a lot of effort going on right now to help protect the veterinary profession. So a lot of this communication at Washington, D.C. is about that veterinarians as essential businesses and making sure that we are protected when this, or at least considered adequately when this legislation moves through. So the specific legislation that I mentioned earlier that passed yesterday and was signed by the president last night is this House Bill 6201, which is called the Families First Coronavirus Response Act. The House passed it on Monday, the Senate on Wednesday or yesterday, and it was headed to the president when I made this presentation. And I just added this little piece this morning that it was signed last night. So we just a half hour ago, I just sent in an AVMA summary document. You should see it on our media or social media pretty soon, as well as at our resource page. It's a very good summary document about what was included in this Families First Coronavirus Response Act. How it will be implemented, I guess, remains to be seen, but at least we've gotten it this far. Just to give you an idea, this was just some screenshots from an open letter from the AVMA to federal, state, and local government officials about how we're positioning veterinarians and veterinary practices as essential services. It talks about the surveillances of disease, particularly reportable and zoonotic diseases. It talks about how we are integral parts of the nation's food and fiber industries, supporting both animal and human welfare and the human-animal bond, care of laboratory animals, which are critical to research. When we think about development of a COVID-19 vaccine right now, veterinarians working in research are critically important. And we also, of course, care for rare and threatened and endangered animals. So this is kind of the framework of how this discussion is being had. You see there at the bottom, of course, you know the AVMA president is Minnesota's own Dr. John Howe. Also signed at the bottom of this letter was Janet Donlin, as well as the board of directors chair. Just to call out that young veterinarian in the upper right-hand corner, the one of Minnesota's own also, Dr. Erica Nagorski, graduated from Minnesota College of Veterinary Medicine a few years ago, and she practices in southwestern Minnesota right now, excuse me. So Erica, if you're on, I'm sorry, but there you are. What else is what else is AVMA doing? Those of you that are AVMA members probably saw the AVMA summary email that came out last night. If you didn't see it, it's kind of an important document. Janet Donlin met with the U.S. Secretary of Ag yesterday, who, if you don't know, actually is a veterinarian, Sonny Perdue. And this is a summary that came out after that meeting. The meeting starts by recognizing the contributions of veterinarians in society and during this time, but it does call out some very specific things that we need to be thinking about. We've heard a lot about the need to conserve personal protective equipment, which really includes, anything that can protect a caregiver from harm. So goggles, face masks, gowns, gloves, these sorts of things. And they're saying that it's time for the veterinary profession to really start thinking strategically about the need to conserve these resources. So how do we think about that? Considering the medical need for elective procedures, for example. Thinking about rescheduling non-essential appointments. So the need to start doing this thing more deliberately is becoming more and more urgent all the time. The AVMA is preparing a guidance document that will be created with FDA input and recommendation. And as soon as I see that, we will push that out through our social media and to our resource page as soon as possible. We are also seeing increasing discussion and reach out for ventilators, as well as the need to potentially repurpose some anesthetic equipment to be used as a ventilator. We expect that we will get some contact, perhaps getting pushed out from the Minnesota Department of Health at some point. Right now, this is being pushed down from government officials through the CVMs and these other organizations here, the Veterinary Medical Association executives. I know Dan has received some communication about this issue in the last 24 hours as well, as an executive director and through the VMAs. One important thing that was also called out in this summary email is that it's really, really important that we think about protecting our staff. If a staff member obviously we don't want our staff to be exposed in the first place, but if a staff member were to become infected with COVID-19 or was exposed to somebody who was infected, it's possible that a local health official may ask you to temporarily close. So again, thinking about working to reschedule on non-essential appointments. We've seen a lot of talk in different states, Iowa, Minnesota, Wisconsin, and others, about the size of multi-person gatherings. It sounds like there was some clarity around that yesterday in Wisconsin, for example, that said that really would not apply to veterinary staff and veterinary employees doing their essential work, but it might apply, or actually it would apply to clients in waiting rooms. So if you still are having clients coming into your building and in the waiting rooms, thinking about putting some sort of policy in place to keep people separated by that recommended 6 feet. I know a lot of you, I know at my wife's clinic being one, clients are not coming into the building anymore. Patients are being received out in the vehicles in the parking lot, and I know that many of you are probably doing that already. And then additional considerations about how we might apply telemedicine and teletriage in this environment. And hopefully in one of these future webinars, we can get Dr. Wilson on from the Board of Veterinary Medicine to kind of maybe provide some clarity around those and some other issues. A brief update from the CVM. I know probably some of you know what's going on with the small animal hospital there, but I thought you might be interested in what's happening with the students. Similar to a lot of our other educational institutions all over the country, The first 3-year students were moved to online classes starting yesterday, and some of the required in-person laboratory things have been postponed to a later date. Perhaps more interesting is the year 4 students who are on clinical rotations right now. And those are completely suspended at this time. Thankfully, these future colleagues of ours are close to graduation, and they're 6 to 8 weeks away from graduation. This could look very different for them and for the people that have to plan for their education should this have happened in much earlier in their 4th year. But at this moment, they're suspended from clinical rotations, and the curriculum committee has streamlined these requirements, and the MVMA is actually looking to clarify some modified expectations for graduation for these students. Currently, options are being explored for some missing core rotations. These seniors, these 4th years have not completed yet. As I mentioned, and as most of you probably know, the teaching hospital is transitioning to an emergency service only at this time. Unfortunately for these 4th years, and unfortunately for me as president, one of the really fun things I get to do this year is speak to the senior students at white coat ceremony and administer the oath at commencement, and those have both been canceled. I know they will look at trying to do at least I understand we will look at trying to do some form of virtual communication, but at this time, both of those in-person events have been canceled. So this information about the college I received from our interim dean, Dr. Mulgard, yesterday, and she also let me know that the D lab is considered essential. I guess I should have wrote essential, not essentially. And so they're trying to maintain the core services provided at the diagnostic laboratory. So lots of stuff going on at MVMA, AVMA, at the college. All the corners of our profession as well as the society are being impacted right now. And the last thing I want to say before we move on to the questions is I just want to remind everybody about personal wellness. We know that that wellness is a big topic in veterinary medicine already, and there are lots of institutions and lots of associations working on different initiatives around veterinary personal wellness, and this is certainly an added stress, not just in terms of administering your medical care, but also in terms of trying to keep your business solvent and learning how to handle your employees as services are not being performed as much, and cutting back hours and maybe having to cutting back on staff. So this is an additional stress. So just want to remind everybody that we need to make sure and take care of ourselves, whatever that is for you, whether it's goat yoga or just taking a nap on a lily pad. Make sure you guys don't forget to take care of yourselves as well. Your own personal health, both mental and physical, is really, really important. So make sure you take that time to unwind at the end of the day. Before we move into questions from the chat box, if they did come in, I just want to take we got 4 questions that were sent in prior to the webinar. I don't want to go by without addressing them. So what are some best practices clinics have implemented? Again, I think the Facebook forum is a great place for you guys to exchange those ideas. I think we're kind of all over the board right now. There's lots of different things happening. Curbside pickup of patients, not allowing clients into the building, putting things in place in terms of keeping people separated in the waiting room if they are still coming inside. If there's anything good about coronavirus, is that if we do a good job of our cleaning and disinfection procedures, it should be highly susceptible. So I would encourage you to join the Facebook group and share these ideas with each other. That is really the intent of that group. And then don't forget about the new Department of Health, Board of Animal Health documents that will be posted at our website today. They might, in fact, be on there already. It was rumored that a bat was involved in the original China outbreak. Is this true? And if so, does it suggest bats or other animals or birds could be vectors? So, again, as I've done my reading, if you remember from SARS and MERS, Those were viruses that were believed to have jumped from an animal species. I think MERS was related to, I think, back to a camel, and SARS, I think, to a civet, I believe. But yes, it has been suggested potentially that COVID-19 did jump from a bat. I think there's a couple different ideas that I read in one article that maybe you have seen as well, that either it evolved to be pathogenic to humans and then was able to and then made the jump to humans, or it made the jump to humans and then evolved to become pathogenic. And that's maybe neither here nor there, but to the question, does this mean other animals or birds could be vectors? Well, at this point, what we know is that at this point there's no evidence that animals can get sick from coronavirus. So at this point, we don't know that animals could be vectors the way we think about vectors or a fomite. I think it's certainly possible or certainly feasible that COVID-19 could live transiently on the mucosal surface of an animal. And so that's why you see a lot of the recommendations of, if you are sick with respiratory signs, whether it's COVID or not, that you need to limit your contact with your pet, is some of the recommendations that are being made. So I think what we know is that at this point, we know that animals don't seem to be able to get sick from COVID-19. Could they be vectors? At this point, it doesn't look like they are in the way that we think about vectors, but it seems feasible that COVID could potentially transiently live on an animal where it's exposed to a human that was infected. What is MVMA's opinion on clients coming into our clinics at this time? Again, I think this is something that you need to decide as a business. Certainly, if we think about how COVID is spread, it's really spread by close person-to-person contact and people coming in contact with infected surfaces. So the more traffic that you have in your clinic, the more potential you have for coronavirus being introduced into your environment. So I don't know that MVMA that we have an official opinion, but I think if we think about how COVID is transmitted between people, it probably makes good sense that the less people we have coming into our facility, the better. I'm a vet tech in Duluth, was working part-time at a grooming salon. We're wondering if the MVMA has any suggestions regarding shutting down. We don't really fall into retail and we don't really fall into veterinary, so I'm wondering if there's someone who can give a little advice here. Boy, I don't want to give clear direction from my seat, but I mean, if we think about essential businesses, I think a pretty good argument could be made that traditional grooming services are not essential businesses. So I guess take that in the context of what we're trying to do here for public health. And at the same time, realizing what we just talked about, that animals don't get sick with coronavirus or with COVID-19 anyways, but they could potentially be a transient vector. So I don't know that I want to give you clear advice, but I think if you consider essential services and you look at what's happening with some of the other non-essential services like restaurants and bars and other entertainment venues, it at least should give you some food for thought. Although at a grooming facility, you probably don't have lots of people in there at one time, but it's a hard question for me to answer with exact detail. Apologies for that. So lastly, I want to take any questions that have come in on chat box. So in my house, yeah, we're dealing, our life has changed too. That's my daughter on the right, Julia, and my son in the middle, Ben. Of course, they're out of school, they're home. So my wife and I are learning how to administer curriculum at the end of a day doing veterinary medicine. My other daughter on the left, Jocelyn, a week and a half ago, she was on a trip with my parents to Austria, which of course is just north of Italy. So she is currently on quarantine with my parents at their house in St. Cloud. So my family is doing a lot of FaceTime these days. And my wife, they're also veterinarian, small animal practitioner. They are learning how to practice in this new paradigm as well. So we're trying to figure this out as we go along in our house too. So Nicole, do we have any questions that came through on the chat?
Yes, we do. Couple of them I will answer first off. Just to reiterate for those of you who are trying to find information, if you go to mvma.org and you right on our homepage, you can click for a page of resources. We are trying to get things up as fast as possible, so please do check back frequently. Somebody was asking again about the Facebook group. That is also found on that resource page, as well as the information on how to subscribe to be part of the listserv that Dr. Boyle mentioned at the beginning of this presentation. If you guys have any issues, please feel free to call us in the office at 651-645-7533 or email us at info@mvma.org and we'll get to you as fast as we can. With that said, questions more in your realm is the MVMA considering making official recommendations for clinics? I've seen dental and ophthalmologist recommendations already being handed down by their official group leaders.
Well, certainly we've talked about it. At this time, at this time we have not. It's certainly something the board of directors has talked about. We kind of felt like at this time we wanted to leave that up to the discretion of the business owners and those of you that are operating hospitals to figure out what's best for your employees and your businesses. At this point, we've really been focusing our efforts on making sure that veterinarians are seen as essential services, so we can stay open to some degree. But I guess if that person wouldn't mind writing in the chat box again, if you're looking for specific recommendations about daily operations or should you close, those sorts of things, maybe add that detail. What I would do is I would refer you to the new documents from the Minnesota Department of Health that I mentioned that just came out in the last hour or so. There are some very specific practical recommendations on those documents, and hopefully those documents will provide you the sort of information that you're seeking. If not, by all means, reach out to me or to the MVMA office and they will make sure that I see the specific advice that you're seeking.
Thank you. A comment from Dr. Garley as she and her staff are online watching. She made the comment that they have removed all at-risk employees from their staff and offered those who do not feel comfortable remaining to leave and collect PTO and then unemployment.
Okay, thank you for that, Ginger. If you have not joined the Facebook group, again, I think that's a great place for best practice sharing and ideas as each of you learn to navigate this environment in your hospitals.
Great. We had a question about a specialty behavior clinic with a large number of new patients with no prior VCPR yet. Any idea of the Board of Vet Med is considering expanding the VCPR to include virtuals for new patients? So I know you mentioned getting Dr. Wilson on one of these,
yeah.
so hopefully we are able to do that.
Yep. I spoke with Dr. Wilson by email this morning, and we didn't talk about establishing a VCPR that way. I do know that her board is considering relaxing the 12-month requirement of a physical exam for a VCPR. So I know they're looking at relaxing that. We did not specifically talk about developing a VCPR that way. So I can't answer that particular part of the VCPR question with certainty, but I can tell you that they are talking about just relaxing the guidelines around a VCPR. And clearly that has real applications for what we're dealing with right now.
Thank you. Another question is that they're a small animal clinic with most of the practices non-essential, but they do obviously help care for sick animals. They've got a good chance, since we might be a good chance of remaining essential, but this individual is afraid of losing their business. So they're wondering if we are anticipating any financial assistance for this gray zone.
Yeah. So again, I would say is that some of that will be covered by that act that just got passed. So if you go to our resource page and look at the summary from AVMA on the coronavirus act that was just signed by the president last night, there is some specific numbers for support and a section on there for impact of veterinary businesses at the bottom of that summary. There also was another, and I'm not quite familiar with the details of this one yet, but there also was a provision passed for the word I'm looking for. There was a provision passed for some issues around taxes for businesses this year as well that just got passed, and that will also be posted as well. So there are some specific things that have happened to that question, and I would direct you to our resource page, and you can see the exact details for yourself.
Another question is, if we're limited to wellness visits, can we suspend reminders for clients? If we do, does it mean that rabies vaccines will expire without client knowledge? We may also have clients ask if they really do need to get the rabies vaccine.
So the question is, can they stop sending reminders?
Correct.
Well, I guess for me, we don't know how long this is going to go on, right? It might be a month, it might be 2 months, but I don't know. I guess that's the first time that's come up. For me, I would say continue to send the reminders, because at some point, hopefully all of you are going to resume normal business operations. And then your clients have those reminders in their possession. The issue of rabies did come up earlier today. And we think about rabies and the ramifications that rabies can have on public health. I think there's a pretty strong argument that rabies vaccination of domestic animals is an essential service. So, boy, if we can't protect that as an essential service, I think we're missing the boat legislatively. So that's kind of how I'm thinking about rabies. And as far as the send out reminder cards, either you hang on to them until things pass and then send them out all at once, but or continue to send them out. But the rabies thing, to me, that's an essential service.
Great. This is a question that they said you're not likely to answer at this time, but if we are deemed essential, what services would we be able to perform? Emergency work only, routine farm visits for herds?
Yes, you're right. I can't answer that question. Right now, the discussion has really been around just making sure we get classified as an essential business. Whether or not we could ultimately be classified an essential business, and then underneath that, there's some framework of services that we're allowed to and to not provide. I don't know that would be there. I think back to the discussion about the protection or the conservation of personal protective equipment and really delaying things that are non-essential. So what's essential for a mobile veterinarian who's serving a dairy farm is different than what's essential for a small animal practice, to be sure. So I know that right now the focus has been on making sure we're classified as essential. Let's presume and hope that ultimately happens, whether there will be a framework underneath that talks about what we can or can't do. You're right, I can't answer that question, and I've not seen any discussion about it yet. But I certainly haven't seen anybody talking about us being classified as essential with a limited scope of practice. So I guess you're right, I can't answer that beyond that.
We've had a couple other questions similar to that coming in about what is considered essential services. So as you said, unfortunately at this time we can't really.
Yeah. I think we're all as medical professionals, we have to use our medical judgment and make those decisions. Nobody knows your clients and your patients better than you. So I think at this point that is up to the That is up to the practicing veterinarian's discretion about what is essential for their patient. I have not seen any specific list that says these are essential, these are non-essential. I mean, we could have silly discussions about certain non-essential things, but I think at this point, I think we have to be able to allow to exercise our own medical judgment about our patients until we get some specific direction. And I don't know that we ever will get specific down to the level of specific procedures.
Last comment is more for the MVMA staff, as the individual, similar to you, Dr. Boyle, is not really a big fan and part of Facebook. So they're asking us to disseminate information via email on the website. And so we will be doing it via email, or I'm sorry, via the website. Emails will just be a reminder to you to link to the website. Otherwise, you're going to get inundated with us every day or multiple times a day if we start sending emails, but more of an email reminder to check our website. And at this time, let me just double check. I'm not seeing any other questions right now. So as Dr. Boyle mentioned, Dr. Ireland will be on next week. That is already scheduled for next week, also on Thursday at the noon hour. And I see that some people have already found it. It is up and you can register for that. So please do so. And if you need help, again, please contact the office and we can help you.
Yeah, based on this discussion today, I think that probably it might be prudent for me to try to see if I can get the Board of Veterinary Medicine on the week after that. So we'll try to make sure we have webinars that are pertinent for the evolving situation. And as always, you know, if you think that we're really missing the boat somewhere, or you don't quite have what you need, make sure you reach out to me or reach out to the office, and we'll do our best to make sure that you guys feel like you have the information you need and that you're well supported in this time.
Thank you, Dr. Boyle. Are there any other questions out there? I'm not seeing any. So again, if you do, please send them to info@mvma.org and we'll try and answer them as quickly as we can.
Thanks, everyone. Have a nice afternoon.
Thank you, Dr. Boyle.